All right, so the vulnerable population that I will be presenting on is those that experience domestic abuse. Domestic abuse is a form of abuse that occurs in the home or between intimate partners, and it can include physical, emotional, sexual, reproductive, financial, and domestic. It's most common in women ages 18 to 34 and among women and men of color. Although it does happen to children, it happens to members of LGBTQ communities, and to men. It can happen to many different ages and types of populations. So this population, like I said, it occurs nationwide. The average is about 1 in every 4 women and 1 in every 9, and it's estimated over 10 million people are affected by this every year. It's difficult to tell exactly how many people are affected by it just because a lot of cases are not reported, but it puts them at increased risk for chronic pain, stroke, heart disease, lung disease, cancer, as well as many other behavioral health concerns. Again, just the size of the population. Locally in Weber County, about 5.31% experience domestic abuse. Statewide in Utah, against women, it's 36.9%, and against men, it is 19.6%. Nationally, the numbers are similar, 35.6% of women and 28.5% of men, so 1 in 7 men and 1 in 4 women. Internationally, it's 1 in 3 women, so about 30%. The statistics statewide are pretty similar to nationwide. Slight differences, but they're very similar. So, social determinants of health. Some examples of those include safe housing, transportation, neighborhoods, racism, discrimination, violence, education, job opportunities, income, access to nutritious foods and physical activity, opportunities, polluted air and water, and language and literacy schools and services. So I think some social determinants of health that people who experience domestic abuse can be at risk for include safe housing, transportation, education, job opportunities, income, access to foods and opportunities, and they also experience violence. All these put them at risk for decreased health outcomes. Some other risk factors, some individual ones include your age, your education, your income, a history of abuse, or a history of substance abuse. Relationship factors can include the people around you, your partners, your intimate partners you choose, and family members, if that's a family you're born into. Community factors can include schools, workplaces, and neighborhoods that might put you at risk. And then some societal factors just include health, economics, education levels, social policies, and social inequity that can happen in different societies. Some other specific concerns. So risk, just to continue the risk factors, this can include lower levels of education, history of exposure to maltreatment, witnessing family violence, harmful use of alcohol, harmful masculine behaviors, and low levels for these women to access paid employment and to have a life of their own or to be able to escape the violence that they're experiencing. Some other health consequences that they can experience is fatal outcomes such as homicide or suicide, injuries, unintended pregnancies, induced abortions, sexually transmitted infections, increased likelihood of miscarriages, many behavioral and mental issues such as depression, PTSD, anxiety disorders, sleeping disorders, eating disorders, increased likelihood to smoke or use and abuse substances, and then some other just general health effects such as headaches and pain and GI disorders depending on the injuries that they experience. The few root causes that I kind of determined are low self-worth, past experience of abuse and neglect, witnessing exposure to violence in the home or in the media, lack of attention or respect, and wanting to be in control. Some of these contribute to like why people experience domestic abuse, whether that's the abuser or the person that is the victim of the abuse. The few that mostly apply to the abuser, it could be wanting to be in control, low self-worth, past experience with it, and witnessing it. those that are victims to it may also be at risk for low self-worth, lack of attention, and past experiences with abuse and neglect that may keep them from escaping it, that may keep them from thinking that they don't deserve to be abused. And all of these can also lead to increased risk of a child becoming an abuser if this is something that they experience while they're growing up. Maslow's hierarchy of needs includes physiological needs, safety needs, love and belonging needs, esteem needs, and self-actualization needs. Most of these are not met for people who experience domestic abuse. This slide just shows some definitions of each of those and whether or not they are met. Like I mentioned, physiologically, these victims usually have a house, they have food. It's typically like their intimate partners who is the abuser, and so they live with them, they share food with them, they sleep with them and such. So those needs are typically met, but almost all the other ones are not. Security and safety, they for sure do not feel safe in their home. Their abuser's emotions are unpredictable. Their love and belonging needs may be met at times, depending on where they're at in the abuse cycle, but for the most part, a lot of times I think it can be confusing for them, and those needs are often unmet. Esteem needs, abuse can cause them to feel like they don't deserve to be treated right, or it may cause low self-esteem and low independence, and all of that, like I mentioned, just is not met in these relationships, which in result, they can never reach self-actualization, which is recognizing their full potential, seeking personal growth, and all of that. So I just included a picture from that same site that shows the basic levels, and just reiterates, just because they're not having their safety needs met, they can't move and progress to have their love and belonging needs met, their esteem needs met, and so on. This means that they have decreased likelihood for good health outcomes, and their functional level is probably pretty low. They don't have a ton of independence, they don't have a ton of resources that they need, and they may feel like they have no access to those things. Communicable diseases. There's a few tests that can be done, and urine tests may show some sexually transmitted diseases. They may also have liver damage and other body system damages due to substance abuse or alcohol abuse. Some other things that they might be at risk for is like dehydration, electrolyte abnormalities, infections, malnutrition, just overall pretty poor health, and probably not a ton of access to this health things that they need. Children that experience domestic abuse, whether they witness it or maybe are born from it and into it, are at an increased risk for bacterial meningitis, hemophilia, bleeding disorders, inflammatory skin conditions, dermatitis, impetigo, congenital syphilis, osteomyelitis, and so on. Non-communicable diseases. This list is pretty long. These people that experience domestic abuse are at a very increased risk for a lot of different issues. Many of them are chronic mental health issues because of the abuse that they experience. Many of them are bruises in various parts of their bodies, reproductive organs, illnesses that they might not match like what they say they are from, just because they are afraid to speak up for that. Repeat injuries from the abuse, and many like reproductive health issues and problems, and just chronic pain from the abuse. Healthcare workers should respond by believing them, providing resources, respecting confidentiality, show them empathy, show that they're not alone, see if they have a safety plan, recognize their strengths, and just do what you can to support them. They're at a really high risk for self-harm and self-care problems, just because it can cause hopelessness and feelings of unworthiness and just a lot of behavioral health problems, as mentioned. And then there also the presence of domestic violence can increase the risk of homicide by 500%. Families that experience threats and violence and domestic abuse, they move a lot because of the abuse, they have a lot of conflict in the house, and it just is not a good environment for children to grow up in. And then here's just a list of a few things that children who grew up with domestic abuse can experience throughout their lives. And so overall, just not great health benefits, not great access to resources. Here's my reference page. And yeah.